We want to get to a brutal issue that is plaguing this country, and that is opioids. Drug overdoses, as you know, Senators, are currently the leading cause of death among Americans under 50, a number that is rising due to opioid addiction. Republicans have proposed eliminating funding for Medicaid expansion, which helps pay for substance abuse treatment. I want to bring in Ashley Hurteau, a recovering heroin addict from New Hampshire, and she has a question for Senator Graham.
Senator Graham, in March 2015, I lost custody of my son, and then 3 months later, on June 11th, I woke up to find my husband dead next to me, lifeless from an overdose. My addiction was so strong and I was so sick that not even his death or losing our beautiful son were enough to get me to stop using. I ended up in jail for crimes that were fueled by my addiction and eventually got treatment through New Hampshire's drug court program, which was 100% covered by Medicaid expansion. So, my question to you is, if Medicaid expansion is cut, what protections would there be to ensure people suffering and dying from addiction would continue to have access to health insurance coverage for treatment?
Really great question. Number one, congratulations on overcoming something that is just incredible. We're all one pill away. You don't know. You don't know till you take the first pill. It's not a character problem. It's just body. You never know. If you get hurt and you take a pill, we just got to deal with it. But it's not Medicaid expansion that saved you. It was somebody who knew what they were doing, who walked you through how to get better. Let's talk about $20 trillion of debt. Let's talk about Medicaid. Medicaid, Medicare, Social Security, and interest on the debt is going to consume all the money you send in the future in taxes. Do you care about the debt? Do you care about her? Can we do both? So here's what I would say about Medicaid. Medicaid is growing twice as fast as health care in other areas. I want to make sure that Medicaid is sustainable and affordable. What do we do to save $1 trillion? We lower the inflation rate 8 years from now. So your state in New Hampshire is going to have the money to design programs that will help your family. They're going to get money that a bureaucrat would have gotten in D.C., their share of the $1.2 trillion, and they can take 20% of that to spend on a Medicaid if they want to. They could take money in the second block grant and go well beyond where Medicaid would let them go. They're going to have more money to help people like you, and here's what I bet. They'll do a better job than the guy running Obamacare or the gal running Obamacare. So if you want to save the country from going bankrupt, we need to get Medicare on a sustainable footing. Charge me more, I can afford it. Younger people, you're going to have to wait a little bit longer to retire because we're living so much longer, but we'll give you decades to get there. As to Medicaid, make it work. Instead of running to the emergency room when you have a headache or a cold under Medicaid and sending all of us the bill, put that Medicaid patient into a family physician network where they can get treated. Better for them, better for you. All I can say is if you do nothing, if we just play like nothing's going to change unless somebody makes it change, Medicaid is sustainable. We don't cut a dime out of Medicaid. We slow the growth. 8 years from now, we give the state the flexibility they don't have today. Here's my bet. They'll do a better job with the money than the Obamacare guy or gal.
Senator, thank you.